David Shulkin is joining us now. He's the former Secretary of Veterans Affairs under President Trump, also served as the president of several hospital networks, including Beth Israel Medical Center in New York City. Sir, thank you so much for being here on the Chris Salcedo Show.
Glad to be there.
Johns Hopkins Center for Health Security has released a study saying that while not perfect, the U.S. healthcare response to the coronavirus threat has been the best in the world. How do you evaluate it?
Yeah, I think what we're seeing is purely miraculous. The healthcare leaders and the healthcare professionals really answering the call, developing surge capacity plans, getting their staff prepared, doing things that, frankly, in all of my years in healthcare, I've not seen being done. And, preparing for the worst, that's what healthcare really needs to do, hoping that we don't ever see the type of patient volumes. But certainly already in New York, I think that the capacity is getting close to be reached. But so far, we've just seen really amazing things happening from our healthcare professionals.
Yeah, what about the preparedness? I mean, a lot of state and federal government preparedness dating back before the Bush administration, whether it's Bush, the Obama administration, and state governments and city governments, they just weren't prepared for a pandemic of this scope. And a lot of taxpayers go, man alive, what have I been dumping billions and billions and billions of dollars into the federal government and these local governments for if our governments aren't prepared? As you saw at the White House right now, they're congratulating private industry for coming to our rescue. What is the way to navigate this going forward, in your view?
Well, I do think that this is readjusting people's view of the role of government, that, government's really there for the safety of the people. And many of us have really thought about that mostly in terms of national defense. But when it comes to this type of issue, this type of pandemic, which is new for many people, this is the first time ever seeing this, they understand that it really does take a government to be prepared, and it does take these types of public-private partnerships. And while we've always had people in our organizations, whether they're government or in private hospitals, whose jobs it really has been to be prepared, they've been what we call tabletop exercises, more sort of theoretical academic exercises that you do on a day and prepare for, but nothing to the scale that we've seen here.
Yeah, no kidding. There are reports out there that certain sections of the U.S. military have coronavirus, and it's going through certain segments. How concerned are you that because of the close quarters that these military personnel are forced to share, that this thing could spread through our military forces?
Well, I think I'm very concerned, as probably most people are. The primary job of those involved in the health parts of the Department of Defense are readiness and making sure that if our troops are needed, that they are ready to fight in their strongest capacity. And when you have large groups of people who are experiencing these symptoms, which can be pretty debilitating, even for a young person, it's concerning. Not only is it close quarters, but our troops are around the world in various areas and often are exposed to things that are out of their control. So the military's done a good job. I think that they jumped on this early. They stopped visitation. They stopped port calls to areas that they felt would put them at risk. And they're certainly managing this, I think, the best that they possibly can. But not having our troops travel right now, I think, is a good and prudent thing.
Yeah, let me just go down the list of some of the problems. CNN, of all places, put out this report that dating back to the Bush administration, Bush and the Obama administration, that at least 3 times, actually 10 times, recommendations to the federal government to stock ventilators. We know about New York's Governor Cuomo back in 2015. It was recommended that he stock 16,000 ventilators. He said no. He had different needs at that time to put the taxpayers' money. Barack Obama blew through all of the stockpile of N95 masks in the federal government and didn't replace them. What is the lesson that we should take as Americans? Is it wrong to put all this trust and frankly, money into the federal government? Shouldn't we work on plans here in our own local communities, in our states, in our towns, rather than turning this all over to the federal government or state governments?
Well, I think No doubt, this has caught many, many people in our government flat-footed, and not being prepared for this. I think we all see the consequences of that. I think it really says that we're going to have to rethink the way that we prepare for these types of emergencies, and frankly, beyond just health. This could be cyber attacks. This could be attacks on our utility systems. This is the role of government, and getting better at predicting when these events are going to happen, how we prepare, how we respond. I think this is a wake-up lesson for everybody. It's not so much finger pointing as it is we have to be prepared, because a lot of lives can depend on our response.
Absolutely. Mr. Shulkin, thank you very much, sir. Appreciate the time here on the Chris Salcedo Show.